Good morning, everybody. Good morning to Health Talk. I am your guest speaker, Dr. Niru Prasad, with my background pediatrics, emergency medicine, urgent care, affiliated with the major hospitals in Oakland. The theme of our health talk today is a behavioral medicine. Joining us today as my guest speaker from Care House is Holly Benz, and we have talked before, but this is the first time I get a chance to see her in person. So she's going to talk about the Care House and what we are doing at that facility and how we are handling our kids and adolescents. So, so good morning, Holly. Before we get started, will you please give your introduction to our viewers?
Yes. Good morning, everyone. Good morning, Dr. Prasad. Thank you so much for having me be able to come and speak with you this morning. A little bit about myself. As Dr. Prasad has said, I'm Holly Baines. I'm the clinical director of the treatment department at Care House of Oakland County. Care House of Oakland County is a nonprofit. We're a child advocacy center located in Pontiac, Michigan. We help victims, children specifically, that have experienced traumatic events such as physical abuse and sexual abuse. So our services are free. We do forensic interviewing. So if there's allegations of abuse or neglect, we have a specialized team of trained professionals that interview the child with a multidisciplinary team being able to be of assistance to watch the interview. So the multidisciplinary team is comprised of law enforcement and child protective services. And if the child is in need of services to help with the healing process after they have made a disclosure of abuse, then the victim advocates in that department will refer to our department, which is therapy. So the therapist will be able to work with the child to process the trauma that they've experienced, give them coping skills, and work with a caregiver to make sure that they're also able to support the child through their healing journey as well. So we have other programs. We have CASA, the Court Appointed Special Advocacy Program. We have a home visiting program as well. So there's lots of different things. We have a nurturing parent program that teaches parenting skills to families. So there's lots of different things that Care House does to help our community.
So Holly, I have been to your place couple of times, but because when I worked at St. Joe Emergency Room Urgent Care, couple of patients, I transferred it to Maple Grove to stabilize. After they are stabilized, then they are sent to your facility depending upon what status of mind they are in. So I usually like to follow my patients, many times follow my children. Then that's how I went to your facility, and I was very much impressed with the work that you guys are doing. And also, I did have a couple of therapists on my health talk, and I'm very happy with them. So basically, I want to find out from you is that what kind of behavioral issue, or is it level 2, or like, not that you don't want to follow anybody acute, right? Because they will go to different facilities. So what kind of individuals, what kind of patient, for our public to know what
Oh,
what kind of patient they will be referred to you.
that's a very good question. Thank you, Dr. Prasad. So the way our referral process works is through Care House. We will receive the referral from intervention. So if there
Okay.
is a disclosure of abuse, if a child has come in for a forensic interview, then the victim advocates who are working with that family will then make a referral to our department. So that would be the first step, that it has to be a child, and it has to be through the intervention department, through our agency. And so the criteria after that would be that the child has experienced a traumatic event and they're maybe just experiencing some symptoms as a result of that traumatic event. So whether it's like hypervigilance, where they feel like they're walking on eggshells, they have
Anxiety, fear.
anxiety, fear of certain
Yeah,
people, places, or
yeah,
things. So something we would look at, like almost like a PTSD diagnosis. They may not formally be
yeah.
diagnosed with PTSD, but some of the criteria that would fall under a PTSD diagnosis.
And also, Holly, you are so close to this Pontiac area. You know, the children's village. Do
Yes.
you send some of them there if they need to be?
Well, that's a good question, Dr. Prasad. So if we feel like a child needs a higher level of care, then
Yeah,
certainly. Oh, sorry, go ahead. So we would work with the parents, and we would make the recommendation if we feel like they need a higher level of care to
yeah.
work with the parents to provide referrals to other service providers, for sure. Yes.
So depending upon the level of their anxiety, where they stand, that's how you take care of them. And do you follow the people, the injured, like a post-traumatic syndrome in patients?
We work with.
PTS due to sports injury and those kind of things.
Yep. So we work with clients that do have PTSD. Was that the question? Sorry.
Yeah, the post-traumatic syndrome, PTS, secondary to like a car accident and all those that they come to the emergency room, to the headache and
Uh,
depressions.
so for based on our grant that we receive, they have to be a victim of crime. So that would be
Okay,
something that would make
okay,
a criteria for them to be eligible. So if they
okay.
are a victim of physical abuse, sexual abuse, if they
Right.
witnessed a homicide, or something like that, then that would be really the population that we would specifically work with.
Yeah,
So there would have to be a crime component
yeah.
associated with the client.
Yeah, so I looked through your website and
Uh-huh.
everything, and it is so impressive. The care house sitting right next to the hospital where we
Mhm.
all can, easily
Yes.
easily follow them. Yeah, and I did want to see you personally a couple of times when I
Oh,
went, but you were
oh,
you were
sorry.
not
Oh,
you were
sorry,
not
I wasn't there.
there. What other facilities do you go besides the care house?
What other facilities? So most of our for our department, for the treatment department,
Yeah.
we are right here just at our office. And the other service that
Okay.
we offer is telehealth. So we're really right here. We're in person at the office at Care House facility on Pontiac and Woodward, and then we do telehealth.
Right.
That's
Yeah.
really for our department. That's where we're at. We do
Oh,
have home visitors, and they do go to clients' homes, but that's not specific to our department for therapy.
mm. So that is good. When I went one time, they had a meeting conference, and I could see through the glass window. How patient, your therapist were, and how they were uh, they were talking to the mother and the child, and then I was very impressed. I was.
Thank you. Thank you. We take pride in really being able to provide a child-friendly environment for the children and for the families that are coming to our facility. And it may sound biased, but we do get a lot of feedback from the caregivers, just like you're saying, like I felt heard, I felt supported,
Right. Yeah.
informed.
Yeah.
Mhm.
Right. Yeah. And then, so it seems to me like we are running short of the mm,
Oh,
time, Holly, because it is, online.
oh,
How can I reach you? When do I get a chance to privilege to meet you in person?
we will set something up for sure. In the very near future. You can just let me know, and I can come into the studio sometime if that would be something you would like. Does that sound
You let
good?
me know
Okay.
when you are available, because basically, we live very close to you.
Yes.
And with my background of pediatrics, emergency medicine, urgent care, I'm also authored a book here, which is a guide to navigating childhood
Oh,
development. If you can see
wow.
that,
Okay.
and what I did is, I added chapter on COVID, post-COVID depression,
Okay.
because with during the isolation period, how everybody was depressed.
Mhm.
So I added that post-COVID depression. I was depressed myself because we couldn't work for a whole year, because of this. So and I'm so lucky that my book got the International Book Award. Yeah,
Oh,
so
congratulations.
and what I did is, Holly, I didn't want to keep any money from the sale of my book from Amazon, Barnes and Noble. I am donating 100% proceeds to to UNICEF Foundation.
Okay. That's
So
amazing.
yeah,
What a great project.
through the UNICEF Foundation, it will go to the third world countries, to the rural areas, where there's not too much education for this kid. So, if and when I get a chance, I like to present you with a copy of my book.
I would appreciate that. Thank you so much.
Yeah, I'm very far. I'm not very far. I live in right within 10 minutes from St. Joe. And anytime when you are in your office,
Okay.
you just text me or email me, and I will be there to see you in person.
Okay.
I'd like to thank you, Julie, for coming to my show. And I'm happy that at least I could get you on webinar. Not in
Absolutely. I'm so thankful that you had me and able to share about Care House and the work that we do and just finding
Yeah,
out more about the projects that you've worked on, and it sounds like they've went to really great causes. So thank you
yeah.
for the
This
work
is
that you do.
Yeah, because this book is, is a very handy book for our parents, caretakers, just to
Yeah.
keep it handy. And like I said, proceeds all go to the UNICEF, a big foundation, UNICEF. They are all over the world, right?
Absolutely.
Yeah. So, all right. Thank you so much for
Thank you,
coming
Dr.
to my show today.
Thank you. Thank you, Dr.
And
Prasad.
then
Thank
yeah,
you.
and then hopefully we will meet soon. I like to thank our viewers for watching me today on Health Talk with Julie Burns, who she is the Care House director at in Pontiac. Thank you very much.